A leader in pediatric and adult heart care for more than 60 years, Texas Children's Hospital was among the first to safely perform heart surgery on children in 1956. Today, we treat some of the rarest and most complex heart cases with outcomes that consistently exceed national standards and provide hope for those facing even the most serious conditions. The Heart Center's home in Texas Children's Lester and Sue Smith Legacy Tower encompasses 8 floors dedicated exclusively to cardiac care, including 4 cardiovascular operating rooms, 4 cardiac catheterization labs, 54 private cardiac intensive care unit rooms, 42 acute cardiology beds, and 27 exam rooms. The Texas Children's Cardiac Developmental Outcomes Program is among the busiest in the nation. More than 1,000 children with heart disease are currently enrolled in our program, which provides regular neurodevelopmental assessments from infancy through adolescence for children who have undergone cardiac surgery during the early stages of life. Routine evaluations are conducted by our expert developmental pediatricians and child psychologists, beginning at 6 months of age. Our program provides family-centered care, starting as inpatients with developmental care rounds, and then in the outpatient setting, where the child's parents or caregivers are directly involved in their child's assessment and interventions for developmental progress. Referrals for appropriate medical, early intervention, special education, and therapeutic services are also coordinated through our program. As part of our outpatient program, we provide educational programming for families, as well as access to social workers and community resources to help with the transition to school. In addition to the clinic, our developmental outcomes team holds workshops and educational sessions for families to help them adjust to some of the unique demands that having a child with heart disease places on them. The Cardiac Intensive Care Unit provides care for critically ill newborns, infants, children, and adults with congenital heart disease. We have 54 beds occupying 3 floors in the Lester and Sue Smith Legacy Tower, and in early 2021, with the launch of the new Adult Congenital Heart Unit, this total will increase to 62 beds. Our Heart Center is unique in that we have developed a subspecialty model of intensive care that offers specialized care by dedicated experts with subspecialty training to the most complex heart disease patients. Our cardiac ICU floors include a dedicated 18-bed heart failure ICU, the first of its kind, as well as a dedicated 12-bed neonatal cardiac ICU that specializes in care for newborns with heart disease. In early 2021, we will open our 16-bed adult congenital heart ICU. Developmental care rounds serve as the foundation for the multidisciplinary efforts to provide developmentally appropriate care to hospitalized patients throughout the Heart Center. Weekly sessions are dedicated to a discussion of factors relating to family-centered, clinically appropriate developmental care goals. Collaboration among family and the care team, including medical providers, occupational therapy, physical therapy, speech-language pathology, and social workers, determine individualized strategies to optimize the delivery of developmentally appropriate care specifically tailored for infants at the highest risk of negative neurodevelopmental sequelae. Tremendous advancements in cardiac care and improvements in survival after surgery for congenital heart disease have resulted in a growing population of adults living with congenital heart disease. Today, in the United States, there are more adults than children living with congenital heart disease. The Texas Children's Adult Congenital Heart Program is accredited by the Adult Congenital Heart Association and provides multidisciplinary care for adults, starting with the transition from pediatric care and then throughout adulthood. Texas Children's is excited to launch a dedicated adult congenital heart unit, which will open in November 2020. Physical, occupational, and speech therapy are an integral part of the care we provide, both pre- and post-operatively. In our therapy gym, therapists facilitate skills, including endurance training, balance, motor strength, and coordination. This gym was designed with cardiac patients in mind and is equipped with developmentally appropriate toys, therapeutic equipment, and an open space for our patients to work with dedicated cardiac, occupational, and physical therapists while inpatient. Our additional therapy gym is designed for the adult congenital heart population. This gym will serve both inpatient and outpatient adult patients. Its close proximity to the adult congenital heart outpatient clinic enhances safety and adds additional convenience for patients.